A controversial deportation. The case of a 4-year-old U.S. citizen undergoing cancer treatment. In a distressing event that has sparked widespread outrage, a 4-year-old U.S. citizen undergoing cancer treatment was recently deported. This incident not only raises serious ethical and humanitarian concerns but also brings to light contradictions within the discourse surrounding immigration policy and family values, particularly among groups that advocate for pro-life stances. The story unfolds. The child, who had been receiving critical medical care for cancer, was deported due to immigration status issues affecting their parents. Despite being born in the United States, a fact that typically guarantees citizenship, the child's situation was complicated by the legal standing of their family members. Reports indicate that the deportation was carried out without consideration of the child's ongoing medical needs, igniting debates over the treatment of families within the immigration system. The pro-life dilemma. This situation underscores a profound irony within certain segments of the Christian community, particularly those who advocate for pro-life policies. Many of these individuals vigorously argue for the protection of life, especially that of unborn children, yet the deportation of a young child undergoing life-saving treatment paints a conflicting picture. Critics argue that the values of compassion and care for the vulnerable should extend beyond the womb. They should encompass all lives, regardless of immigration status. The broader implications. The deportation of a U.S. citizen, especially a minor with serious health needs, raises significant questions about the legal and moral responsibilities of the government. Advocates for immigrant rights point out that such actions can lead to devastating consequences for families and their members, especially children who rely on consistent medical care. This incident highlights the complexities of immigration enforcement and the often harsh realities faced by families entangled in the system. Healthcare advocates also express concern over the intersections of immigration policy and access to essential medical treatment. For children with serious health conditions, stability and continuity of care are paramount. Disruptions caused by deportation actions can jeopardize not only health outcomes but also the emotional and psychological well-being of affected families. A call to reflection. As the nation grapples with its immigration policies, this incident serves as a poignant reminder of the human cost behind legislative measures. It calls for a compassionate reevaluation of how policies affect families, particularly the most vulnerable among us. If discussions surrounding life and protection are to hold true, they must encompass all children, irrespective of their family's immigration status. In conclusion, the deportation of this young U.S. citizen underscores the need for a more humane approach to immigration, where the welfare of children and families becomes a priority. Recognizing the interconnectivity of life-affirming values and compassionate immigration practices can pave the way for a more just and empathetic society.